In this video, I want to go deeper. First, I'll explain what the brain actually does and why it matters so much. Second, I'll go through common brain-related diseases and disorders, from stroke and dementia to Parkinson's disease, epilepsy, migraine, and mental health effects. Third, I'll look at what natural support for the brain really means, including specific foods, fruits, vegetables, and nuts that fit the evidence best. And finally, I'll connect that to older healing traditions and how modern medicine is now testing some of those ideas more carefully. Section 1. What the brain actually does. The brain controls both the obvious and the invisible parts of life. It helps you think, plan, learn, speak, move, and remember, but it also helps regulate sleep, emotion, coordination, breathing patterns, and many other body functions. NINDS explains that different areas of the brain do different jobs. For example, the hindbrain helps control vital functions such as breathing and heart rate, while the cerebellum helps coordinate movement. This means brain health is not only about memory, it is about the whole quality and rhythm of human function. At the most basic level, the brain works through neurons. These cells pass signals from one part of the brain to another, and from the brain to the rest of the body. When those signals are healthy and balanced, you think clearly, move well, and respond normally to the world. When those signals are interrupted by injury, poor blood flow, degeneration, inflammation, or abnormal electrical activity, brain disorders begin to appear.
Subscribe to our channel before watching the next part.
Section 2. Why brain health matters so much. Brain health matters because once brain function is disrupted, the effects can spread everywhere. Problems with the brain can affect speech, balance, mood, personality, memory, sleep, concentration, movement, and independence. WHO says neurological conditions are now the leading cause of disability-adjusted life years globally, and more than 3 billion people were living with a neurological condition in 2021. WHO also says around 70% of the global burden falls on low and middle-income countries. That global picture is important. WHO reports that stroke, migraine, dementia, meningitis, and epilepsy are among the biggest contributors to neurological burden, and Parkinson's disease is the fastest growing neurological disorder. It also notes that Southeast Asia and Africa carry especially large burdens from problems such as neuroinfections, premature birth, and neonatal brain injury, while access to neurologists and neurological services remains far lower in poorer countries. So when we talk about brain health, we are not talking about a luxury wellness topic. We are talking about one of the biggest public health issues in the world. Section 3. Common brain-related diseases and disorders. Let's start with stroke, because it is one of the most serious and most preventable brain conditions. Stroke happens when blood flow to part of the brain is blocked or a blood vessel bursts, and brain cells begin to die from lack of oxygen. NINDS says high blood pressure is the #1 risk factor for stroke, and it recommends cutting down on salt and eating fruits and vegetables to improve vascular health. That makes stroke one of the clearest examples of where natural support and medical prevention meet. Food, blood pressure control, movement, and medical treatment all matter. Next is Alzheimer's disease and other dementias. These are brain disorders that gradually damage memory, thinking, and reasoning. NIA says dementia is not a normal part of aging, and while no single food or supplement has been proven to prevent Alzheimer's, healthy eating patterns such as the Mediterranean and MIND diets have been associated with cognitive benefits in research. NIA also reports that these diets, which are rich in vegetables, fruits, whole grains, olive oil, beans, nuts, and fish, were associated with fewer signs of Alzheimer's brain pathology, with green leafy vegetables standing out in particular. Then there is Parkinson's disease, a progressive brain disorder that affects movement and can cause tremor, stiffness, slowness, and balance problems. NINDS says physical activity such as walking, yoga, cycling, and swimming can help people with Parkinson's disease by improving mobility, flexibility, balance, and strength. That is important because natural support here is not about pretending exercise cures Parkinson's. It is about recognizing that movement is one of the strongest evidence-based supports for function and quality of life. Another major brain condition is epilepsy. NINDS defines epilepsy as a chronic brain disorder in which groups of neurons sometimes send the wrong signals and cause seizures. This is one of the few areas where diet can sometimes move from supportive into therapeutic. NINDS notes that the ketogenic diet, a high-fat and very low-carbohydrate diet, is an age-old treatment for some medication-resistant epilepsies, but it should be medically supervised because it is a clinical intervention, not just a trend diet. Then there is migraine, which is far more than a bad headache. NINDS describes migraine as recurrent attacks of moderate to severe throbbing or pulsating pain, often on one side of the head. Migraine is also one of the largest contributors to neurological disability worldwide. For some people, triggers include stress, disrupted sleep, dehydration, or irregular food patterns. Brain health is not only about preventing major disease, it is also about understanding recurring brain-related distress that disrupts daily life. And then there's the area many people forget when they talk about the brain: mental health. NIMH says mental health includes emotional, psychological, and social well-being, and is essential to overall health and quality of life. Brain health is not only about memory scans or neurological diagnoses, it is also about mood, resilience, attention, stress regulation, and the ability to function emotionally day to day. Section 4. What natural healing really means for the brain. So, what does natural support for the brain actually look like when we remove the hype? First, it means protecting blood vessels. One of the strongest brain health strategies is not exotic at all: control blood pressure. NIA says controlling high blood pressure is known to reduce the risk of heart disease and stroke, and might also help prevent or delay Alzheimer's disease and cognitive decline. In the SPRINT Mind trial, lowering systolic blood pressure in older adults at high cardiovascular risk significantly reduced the risk of mild cognitive impairment and slowed the buildup of white matter lesions linked with dementia. Second, it means exercise. NIA says physical activity is essential for healthy aging and can reduce anxiety, improve sleep, lower blood pressure, and reduce the risk of stroke, depression, and dementia. It also notes that older adults can work toward 150 minutes of moderate intensity aerobic activity a week, plus muscle strengthening work. That is one of the clearest examples of natural support that is both simple and powerful. Third, it means sleep. NINDS says sleep is important to a number of brain functions, including how neurons communicate with each other. In other words, poor sleep is not just annoying, it affects how the brain processes information and restores itself. If someone wants better brain health but lives in chronic sleep debt, that foundation is already unstable. Fourth, it means food patterns, not miracle foods. NIA is very clear that no individual food or supplement has been proven to prevent Alzheimer's disease, but it also says that healthy eating patterns like the Mediterranean and MIND diets have been associated with cognitive benefits. These patterns repeatedly bring us back to the same foods: berries, green leafy vegetables such as spinach, kale, and romaine lettuce, beans, whole grains, olive oil, fish, and nuts. NIA's Alzheimer's pathology study also found that green leafy vegetables were particularly associated with less Alzheimer's-related brain pathology. So, if you want specific fruits, vegetables, and nuts to name for your audience, the most evidence-aligned list is this: berries for the fruit category, especially within the MIND pattern, spinach, kale, and romaine lettuce for vegetables, and nuts as part of a brain-healthy overall eating pattern. The key message is that these foods support a healthy dietary pattern, but they are not magic shields. That distinction matters. There is also a more targeted point for migraine. NIA notes that one study in older adults with frequent migraines found that a diet lower in vegetable oil and higher in fatty fish reduced migraine headaches. That does not mean migraine can be fixed with fish alone, but it does suggest that in some cases changing the balance of fats in the diet may influence symptoms. For mental health, NIMH says self-care can support mental well-being and treatment recovery. Its guidance is basic but powerful: regular exercise, healthy regular meals, enough water, and attention to how caffeine and alcohol affect mood. Again, nothing glamorous, but a lot of real brain support is built on unglamorous consistency.
Subscribe to our channel before watching the next part.
Section 5. Ancient Traditions from Old Medicine to Modern Evidence. Long before modern brain scans and neurology labs, traditional medical systems already treated the mind, memory, sleep, balance, and emotional state as central to health. WHO's current traditional medicine framework says traditional, complementary, and integrative medicine should be brought into health systems in ways that are evidence-based, safe, and properly regulated. That is exactly the right approach for brain health. Respect the history, but test the claims. One of the best modern examples is Tai Chi, a traditional Chinese movement practice often described as a moving meditation. NIA reported in 2024 that a specially enhanced form of Tai Chi improved cognition in older adults with mild cognitive impairment. The same source also notes prior studies showing Tai Chi helped people with Parkinson's disease improve balance and reduce fall risk. That does not prove every traditional practice works for every brain disorder, but it does show that some older practices can have measurable modern value when properly studied. So the balanced message is this: ancient traditions were often right to value rhythm, movement, breath, focus, and whole person balance. Modern medicine adds testing, diagnosis, drug therapy, rehabilitation, and evidence standards. The smartest path is not ancient versus modern. It is careful integration where the evidence supports it. So let's bring it together. The brain is not just an organ for thought. It is the control center for movement, memory, emotion, behavior, sleep, and survival. When brain function is disturbed, the effects can show up as stroke, dementia, Parkinson's disease, epilepsy, migraine, or emotional and cognitive decline. And globally, these problems now affect more than 3 billion people, with the heaviest burden falling on lower resource countries. And the natural support is not mysterious. It is usually the simple things people ignore: controlling blood pressure, moving regularly, sleeping properly, eating a brain-healthy food pattern, staying hydrated, and respecting the difference between supportive habits and actual treatment. It is berries, leafy greens, beans, whole grains, fish, olive oil, and nuts as part of a pattern. It is exercise for blood flow, mood, and function. It is sleep for neuron communication. And it is knowing that some conditions like seizures, stroke, or rapidly worsening neurological symptoms are not wait-and-see problems. That is the real lesson of natural healing for the brain. Support the system wisely, reduce the risks you can reduce, and never let the word natural replace diagnosis.